Hi everyone and welcome to our Facebook Live. Today we're going to have a great episode. I am joined by Chair and Professor of the Department of Public Health Policy and Management, Dr. José Pagán, and visiting PhD student from the University of Pavia in Italy, Daniele Palla. Hi, welcome guys. Please remember we are coming to you live, so if you have any questions or comments, drop them in the comment section down below and we'll get back at you. Dr. Pagán, thank you for joining us today.
Thank you.
Can you please tell us a little bit more about your role inside and outside of NYU?
Yeah, so I'm department chair. I'm a professor in public health policy and management, and I'm also I'm a health economist, and I'm director of the Center for Health Innovation of the New York Academy of Medicine. Mm-hmm. At NYU, we have in the department master's and a PhD degree with concentrations in policy and management, and also a PhD program in public health policy and management. And then at the Center for Health Innovation of the New York Academy of Medicine, we also handle several projects, research projects. One of them happens to be this European Commission project, and part of the reason why Danielle is joining us in this.
And how did you get involved with the European Commission?
Basically over the years you develop a network of investigators that you rely on, work on. The European Union funded a huge initiative called Horizon 2020, basically to push research forward. They invested billions of dollars. And one of the activities that they did is they said, okay, we want projects connected to big data and public health. So this whole team of investigators from different parts of the world, led by folks at the Universidad Politécnica de Madrid, mm-hmm. but also investigators from Pavia, from Padova, from France, all the way from even Singapore, Serbia, got involved in this. And we put together a proposal to look at basically health issues in 5 cities, asthma and diabetes.
That's very interesting. And may I ask, how did you choose these 5 cities? Were there any demographic factors that made them unique?
What makes them unique is the fact that they're cities that are very interested in the integration of technology to improve health. They are cities in which the leadership is very interested in thinking about solutions to improve the health of the population. So Birmingham, for example, the city is very interested in it and is part of it in the UK. Barcelona has a very large and well-known health department, so they're part of the project. Paris is Paris and New York is New York. So these are cities that are large and that issues connected to air quality and diabetes are forefront. And then Singapore, city-state, tons of researchers there that we work with from Europe, actually, that are in Singapore. Mm-hmm. So it made for a unique opportunity to basically collaborate and think about activities that we could do together. And this project provided the funding and the platform to make that happen.
Amazing. And Daniele, can you tell us a little bit more about your trajectory and how you are also involved in this project?
Okay, sure. So my trajectory is actually pretty simple. So I graduated in bioengineering at the University of Pavia. I took both my bachelor and master's degree there. And so bioengineering is a very generic word that could mean a lot of things. And so I've had the chance during my studies to explore a lot of fields of bioengineering, such as biological modeling and biomechanics, bioinformatics, all these things. But then I decided to focus my career and my studies on data mining, and in general working, for big data, with big data for health. And I've been involved in a lot of big data projects with health purposes, like precision medicine projects, bioinformatics projects, and now also public health. So last year, I decided to do a PhD in bioengineering, also always in Pavia. And I went to speak to my supervisor to find out what kind of project his department was working on, and he told me about this Pulse project. That actually, when I when I decided to do the PhD, the project had already started from some months. So he told me about what it was all about, and the cities that were involved, and so I found it very interesting from the first moment. And I've never worked before in public health, so it was also a good chance to actually expand my fields in which I was working, and so I joined the project, and I'm here because we have this partnership between all these famous institutions around the world. And I work with data, and actually New York is like a gold mine of data for us, because here we can find really an infinite quantity of data that we can actually use for our project. And so this is basically it. I mean, it's not that interesting story, but
It is. It is interesting. So for those who are watching and may not know, what is big data? Because you mentioned a few times, but what's actually big data?
Okay. So again, it's a very generic concept. Let's say we usually, with big data, we mean like a quantity of data that is so huge that actually it cannot be visualized or analyzed with, let's say, common techniques. So it's like you characterize big data because they are very, how can I say, it's like, it's very fast to acquire them. They are they have some features that make it very difficult to actually analyze them, and so you have to design new procedures to make the data speak.
Right,
somehow.
like mean something.
So exactly.
And is this where the data mining comes in?
Yes.
Okay, so basically you're just mining data out of this really big chunk.
Exactly. So you have a big quantity of data. Usually it's, this data is very sparse, very noisy. And so it takes months just to do some pre-processing on it. And what you want to do is to actually find out something, or be able to predict things from this data you're analyzing.
Perfect.
And you cannot do it just opening an Excel file and looking at it. You have to design very complex algorithms to do that.
Amazing.
Yes.
And bringing it back to the project we were talking about, you're working on an app that is going to help prevent diabetes and asthma. So how does that prevention look like?
Yeah, so part of the challenge that many of these cities have is they have a lot of data, right? They have a lot of information that could be used to improve people's health. So one of the ways in which we're thinking about improving health around those two issues, asthma and diabetes, is basically by connecting different pieces of data. So for example, in a city, you have data that comes from air pollution data. Can we take that information and then provide, not only use it in the modeling that you're doing, that's part of the reason why Daniel is in New York, because he's doing basically computer modeling, but also how can you use that data to then push it down to the user, to the citizen, to the average citizen.
Correct.
So for example, you wake up in the morning, and you know something about pollution levels in your city, that information could be used to decide how do you plan to spend that day, or it could also be that through that app we integrate information like suggestions about health education, healthy eating, exercise, information like that.
Okay.
That could change the way in which you distribute your day.
That sounds very interesting.
Yeah, it's very hard to put it all together.
I bet.
But I think something that Daniel mentioned is the work that he's doing here, for example, I think is really, really exciting, because most cities don't have something that is unique about New York is the amount of data that we have. And Daniel is working on data connected to air quality and air and pollution. And many times we think about the outcome as being asthma or diabetes, But we also have data on hospitalizations. So we're integrating the two, basically saying, okay, these health conditions have an impact on people, but they also impacts the healthcare delivery system. Yeah. And you've been working on that over the last few months, right?
Yes. And what we are trying to do with this app is actually, I think the most innovative thing is that we are trying to reach directly the users that use it, and also actually the public health policymakers, because we have actually a part of the project in that. So we are trying to connect them and to actually, provide an instrument to improve well-being in the cities and prevent asthma and diabetes, giving directly this instrument to the people that live in that city.
Now, so you're using data that is basically being tailored so that it can reach to the population. And I'm assuming it reaches people through their smartphone or the internet. So how do you deal with inclusion issues when the people who are accessing the intervention require a smartphone or access to the internet?
So, almost everyone nowadays has a smartphone and so on. So, but the inclusion issue is very important. We for example, as we are working on the app, we are making sure that in the design process we include information not only on the socioeconomic status and educational levels of the folks using the app, that is very broad, but also issues like language and so on, culture. So one of the interesting things about a project like this is that every question you ask, every feature of the app or the project, you have to come to consensus in a group, and it's every country has a different goal, or every city has a different goal and different ways of different things that they want from this app. So it takes several years to basically put it all together. So for example, in a city like New York, we are targeting certain neighborhoods. We make sure that we have diversity in terms of the neighborhoods, in terms of socioeconomic status, and so on, to make sure that the app appeals to the broader population.
Perfect. And how would you say that technology, now that we hear that you're working on an app and you're using all this data, so how is technology affecting public health nowadays?
I'll get started with that, and then you can fill in the blanks on that, because I think this is your area in a way. But the thing that I think about this, you can do it. The thing about technology, I think it's I'm gonna start with this issue of data.
Okay.
The fact that there's a lot of data out there, and it keeps increasing and increasing and increasing, and to me, it's like, how do we then use all these tools, from the app that we're working on to all the modeling work that you do as an engineer, to put together that information and make it useful to people. So we have data, I don't know if it's up to the second or the minute, on pollution, but how do we take that information from that sensor and make it useful to an individual or to a public health system?
I think that here we are actually coming back to the definition of big data, in my opinion, because I'm not a public health student, so I don't know I'm not an expert in public health, but I think that with technology now, it's actually very easy to gather data, a lot of data, and also it's very, we can do it very quickly. And somehow I think that technology is really helping public health, but it's in a certain way also becoming necessary, because when we have to manage all this huge quantity of data, we actually need to design new tools to do it. Okay. And so I think this is kind of necessary, and it's also, through technology we are able to actually assist people also almost real time. And also on different levels, because in this project we are integrating a lot of different kind of data that come from also a lot of sources.
Yeah.
So this is what I think. So I guess it's kind of very useful for public health, and in a way also necessary to do that.
Yeah. So we actually just received a question from the audience. So Rosa asks, how are you addressing prevention of these diseases? For example, with nutrition, etc.
So right now what we're building is a platform to integrate data and information, meaning the platform being the app, and also a portal or a web page that would integrate a lot of this information. So when it comes to prevention, it may be through basically providing health education through the app, but it could also be about providing resources through this web-based platform where if you're a city and you're trying to develop something connected to healthy eating, exercise, and so on, you would be able to go there and get, for example, maps that tell you where food deserts are, or basic data that allows you then to make a decision when you develop a prevention intervention. And by the way, this is something that we're doing for 5 cities, but the idea is to, when this goes live, to make it open to anyone. So if any city wants to join, they can join. And actually Pavia, which is where Daniele is going to school, is interested in this, right?
Yeah, we're actually starting to, we decided to, add Pavia as pilot site also in this project, because actually, Pavia, it's a small city, but it's like 20 miles south from Milan. So it's not, there are not a lot of industrial places or factories, but due to its geographical position, because it's in, like in a valley that is closed on every side by the mountains, actually we have, especially in the winter, a serious problem with air pollution in Pavia. And so we thought that it was interesting to bring this project also to Pavia in order to take a step in the right direction to actually assist people that is suffering from these air pollution problems. And it's also interesting to see what the rest of the world is doing about it.
Great.
Somehow.
And so, Dr. Pagán, as the director of the Center of Health Innovation at the New York Academy of Medicine, what type of technology/public health collaborations would you like or expect to see in the future?
Yeah, so I spend some of my time there, basically leading or running several research projects. One of the areas that we're working on there is on computer simulation modeling. So we can, for example, we do work on simulating disease progression, asthma, diabetes, so that a city, for example, could decide, if you intervene at a certain point, if you develop a program, a prevention program, what impact would that have on the number of cases of diabetes over 20 years? How much does that cost the healthcare delivery system? How many foot amputations do you avert? Cases of blindness and so on. So we do a lot of work around that with data. Also a lot of work on claims data. We have a claims data lab at NYU. I don't know if you know that. It's a club, right? It's a club we have.
They've been in the podcast.
They have been in the podcast. Okay, great. So the claims data lab is basically a partnership with a consulting company called Milliman. And claims data is basically every time you go to a doctor and somebody pays for it, that data is basically that data. And we basically have many students actually very interested in this and working with claims data, because it's a way that you can manage or know not only about health but also about cost of care.
Perfect. And Daniele, now that technology is surging as a tool for public health, I bet that with everything that you've studied, you have interesting projects that maybe are in the horizon.
Yes. So I'm actually working like 90% of my time on this project, but this project is so so wide that working at this project, it's actually like working at a lot of different projects at the same time.
I can imagine.
And yes, and also being here in New York, I started to work also on different things. So right now we are like with my team in Pavia, we are working at some parts of this project. So we are developing a decision support system that is basically the engine inside the system that takes in all the data that comes from the users and runs like risk models and provides feedbacks to send directly to the users. We are also working at WebGIS, so a geographic information system in which all the users will be able to visualize the data about the situation in their cities directly on maps. And then here I'm working, as Dr. Pagán was saying, on hospitalizations data. So we have a very large data set here that contains data about the hospitalization in all the state of New York from 1995 to last year, 2017. And so we are working on the relations between hospitalizations and a combination of a lot of factors such as air quality and also socioeconomic factors, demographic factors, and so on. And what we want to do is to I would say, break down this problem to a neighborhood level, because New York City is as we all know, it's a very complicated city. There is literally all the world living here, and social disparities are very emphasized. So all the neighborhoods have different situations, and so when you study something like this in a city like New York, you actually have to study the differences between all the neighborhoods. And so what we're doing is applying some data mining tools, but with also geographic description to New York City to actually spot both the short-term conditions, for example, how air quality impacts in a certain day, in a certain moment, people that are suffering from asthma. But also the long-term ones. So after an exposure that lasted for years or months, how is this exposure actually going to impact on people? And so we are actually also considering a lot of other different factors like socioeconomic factors and so on. And we are trying to build predictive models that can actually be able to predict who is going to be hospitalized for either asthma or type 2 diabetes, considering the combination of these factors and the environmental conditions. So this is very very interesting. And then I'm working also some other projects like precision medicine projects, but they're not really interesting for this today.
I bet they are.
Everything is interesting.
Everything is very interesting. And finally, what motivates both of you to do this work, to put in the hours, and just to do so much?
I don't know. I get into projects first because I find them interesting. Second, a lot of it has to do with discovering something new or a new way of doing things. Many times it can get personal. It can be that you feel like maybe because you have friends or family members that experience, say, asthma or diabetes, it becomes more personal. So you become a little bit more you feel like you know a little bit about the topic and you want to contribute to solving that. And in the case of this issue of things that are connected to the environment and so on, the fact that it's beyond the control of the population in some ways, we have a good platform at the College of Global Public Health to do something about that and be that voice. So to the extent that we can be that voice and say, okay, here's the data, here's what we found from the data, can we do something about this specific problem? We know the problem is connected to a given neighborhood or a given source of pollution, or the policy solution can be done by the city or some agency, then we can intervene. So some combination of those factors is what basically drives you to do the work. And your kids, of course, you think about the future and so on. So.
Yeah, I mean, what really motivates me is, well, on one hand, it's actually funny to do that, because when you have to find the solution of a problem and also write the code to run the algorithms, it's actually funny to do that. But I really think about the results that we can achieve. So what for me is just numbers and formulas and computer programs, then it could actually turn into a tool that really helps people directly. So and I think it's it's cool to do it.
Yeah.
So this is really how I find the purpose.
Perfect. So thank you so much for joining us today. It's been great. And thank you to everyone that is watching us right now. If you have any further questions about all the programs that we offer at NYU, I invite you to visit publichealth.nyu.edu, and we'll see you next time.